In 1918, America was dying. Not quietly, not slowly. People collapsed in the streets. Coffins stacked faster than graves could be dug. Entire towns went silent overnight. But for Black Americans, the danger wasn't just the virus. It was abandonment. White hospitals shut their doors. Doctors turned people away. The Red Cross refused Black nurses. And as the dead piled up, America made a decision. Some lives would be saved. Others would be left behind. This is the story of the women who refused to accept that. The Spanish flu moved faster than any war. 1/3 of the world was infected. At least 50 million people died. In the United States, the virus struck military camps, cities, and rural towns with terrifying speed. Strong men collapsed in hours. Children suffocated in their sleep. Families watched loved ones turn blue as their lungs filled with fluid. Hospitals overflowed. But overflow meant something different depending on your skin color. White hospitals posted signs, "No colored patients." Black families begged at emergency entrances, turned away even as relatives gasped for air. Doctors refused house calls, ambulances didn't come. The message was clear: survive on your own, or don't survive at all. And as fear spread, segregation tightened its grip. The American Red Cross called for nurses. Thousands volunteered. Black women volunteered too. They were trained, qualified, ready. But the Red Cross said no. They claimed white patients wouldn't accept Black care, so they rejected the very women willing to risk their lives. As the pandemic worsened, the hypocrisy became impossible to hide. In Black neighborhoods, death moved unchecked. Churches became makeshift morgues. Homes turned into hospitals. Children buried parents. There were no ventilators, no oxygen, no government aid, just prayers and fear. But inside one institution, something different was happening. In Washington, D.C., Freedman's Hospital stood as one of the only Black medical institutions in the nation. Originally built for formerly enslaved people, it was underfunded, overcrowded, and crucial. As the flu raged, its staff watched the crisis unfold. They knew what abandonment meant, and they knew what was coming next. 18 Black women trained at Freedman's Hospital were given a choice: stay safe or go where no one else would. Plague-stricken towns, segregated army camps, communities already written off as lost. No guarantees, no protection, no promise they'd return alive. They said yes. These women weren't soldiers. They carried no weapons, only medical bags, training, and courage. They were daughters, sisters. Some were barely out of school. They knew what white America thought of them, and they went anyway. They entered towns where entire families lay sick. They treated soldiers who had never been touched by a Black woman except in chains. They worked until exhaustion collapsed them. No praise, no headlines, just survival. And sometimes, not even that. History barely recorded their names, but their work saved lives, and their courage changed American medicine forever. Before WW2, before desegregation, before recognition, they stood in the gap when America refused to. This is their story, and it doesn't end here. Freedman's Hospital was never meant to thrive. It was created after slavery, not as an investment, but as an afterthought, a place to care for Black bodies when no one else would. Underfunded, overcrowded, constantly questioned. But inside its walls, something rare existed. Black doctors teaching Black nurses, Black knowledge preserved and shared in a country that tried to erase both. The women who trained at Freedman's hospital were not protected from reality. They were prepared for it. They learned medicine without luxury, without excess supplies, without backup. They learned how to improvise, how to stretch resources, how to treat patients when help wasn't coming. Because in Black communities, help rarely did. White nursing schools taught technique. Freedman's taught survival. Students learned anatomy, sanitation, and disease control, but they also learned something else, that they would be doubted, disrespected, undervalued. Racism wasn't an obstacle, it was part of the training. They were taught to work twice as hard for half the recognition, because that was the world waiting for them. In 1918, many Americans believed Black people were immune to the flu. Others believed Black patients felt less pain. These lies killed people. At Freedman's, nurses were taught to challenge superstition with science. They studied symptoms, tracked progression, documented outcomes. They treated patients as human beings, not myths. That alone made them dangerous to ignorance. As the flu spread, Freedman's filled beyond capacity. Beds lined hallways, patients slept on floors. Nurses worked through exhaustion, sometimes collapsing mid-shift. They watched coworkers get sick, some never returned. And still, training continued, because stopping meant death for someone else. No one promised them protection. There was no insurance, no hazard pay, no guarantee their families would be cared for. If they died, history would likely forget them. They knew this, and they stayed anyway. So why were these women chosen? Because they were already doing what white institutions refused to do, caring for the unwanted, treating the dismissed, entering spaces marked dangerous. They were used to risk, used to being invisible, used to stepping forward when others stepped back. When the call finally came, it wasn't traumatic, just papers, names, destinations, small towns, military camps, places already overwhelmed. Some women cried quietly, others prayed. No one refused. They left families behind with no promise of return. They boarded segregated trains, sat in isolated cars, traveled toward sickness. They carried medical bags filled with tools and fear, but also resolve. By the time the train stopped, the real test was about to begin. The training was over. The protection was gone. Ahead waited towns where death had already won. And the women from Freedman's hospital were about to walk straight into it. When the nurses stepped off the trains, the silence was unsettling. No crowds, no voices, no relief. Entire towns felt abandoned, as if life had simply retreated. Shutters were closed, streets were empty. The air itself felt heavy. This wasn't a medical crisis anymore. It was a graveyard in progress, and they had arrived too late for some. Inside homes, the scene was worse. Whole families lay sick in single rooms, parents delirious, children crying beside bodies that would never wake. The nurses moved quickly, masking fear with training. There were no proper hospitals, just beds pushed together, floors covered in blankets. Death had no schedule. It came morning, noon, and night. White nurses refused these assignments. Doctors stayed away. But the women from Freedman's hospital didn't hesitate. They cleaned bodies others wouldn't touch. They fed patients too weak to lift their heads. They sat beside the dying so no one would leave this world alone. They became nurses, caretakers, and witnesses. Some were sent to military camps. Young soldiers lay packed into tents, feverish, coughing, gasping. Many had never spoken to a black woman except through orders or insults. Now, those same women held their hands as they died. Prejudice faded quickly when breath disappeared. There were no gloves to spare, no masks that truly worked, no medicine to stop the virus. They reused bandages, shared supplies, washed hands until skin cracked. Every patient was a risk. Every breath could be the one that infected them. They knew it, and they stayed. Then it happened. One of their own collapsed. A fever, a cough, weakness spreading fast. There was no evacuation, no special treatment. She was placed in the same beds she had prepared for others. The nurses took turns watching over her, praying, waiting. Not everyone survived. Some nurses died far from home, buried in towns that barely knew their names. No military honors, no headlines, just a quiet grave in grieving sisters who kept working. They didn't have time to stop. The sick kept coming. Why didn't they leave? Because leaving meant surrender. Because if they walked away, no one else would come. They understood something America didn't. Care is an act of resistance. Showing up was defiance. They worked through tears, through exhaustion, through loss. Some nights they cried quietly together. Other nights they said nothing at all. Grief became another burden they carried in silence. By the end of winter, something shifted. Death rates began to fall. Communities that were written off started to recover, and slowly word spread. Where the black nurses went, people lived. Their courage was rewriting outcomes, and America was beginning, finally, to notice.
History often remembers numbers, death counts, infection rates, statistics, but it forgets people. The black nurses who fought the 1918 pandemic were almost erased entirely, their work folded into footnotes, their bravery buried beneath bureaucracy. But their names survived. And names matter, because names prove presence. Buried in Red Cross correspondence, military reports, in Freedman's hospital archives, are traces of these women. Not praise, not medals, just proof they were sent where no one else would go. Proof they were trusted when desperation overrode racism. One name appears again and again. Aileen Cole. Trained at Freedman's hospital, she was deployed to multiple plague zones, civilian towns, and army camps. Her reports describe overwhelming sickness, insufficient supplies, and patients abandoned before she arrived. She stayed anyway. Her calm under pressure made her indispensable. In segregated military camps, black nurses were assigned the worst cases, men already written off, men already dying. Aileen Cole and others worked through nights thick with coughing. They cleaned bodies, managed fevers, documented symptoms. They became the last faces many soldiers ever saw. Another name surfaces, Clara Rollins. She was sent to remote southern towns where entire black communities were collapsing. No doctors, no hospitals, just homes turned into infirmaries. Clara organized care where none existed, teaching families sanitation, isolating the sick, saving children who would have died otherwise. Sometimes they arrived too late. Sometimes entire households were gone. They recorded deaths by hand, said prayers, closed eyes, and then moved on, because stopping meant more loss. This was triage at a human scale. Frances Elliott's name appears in Red Cross files. Ironically, after black nurses were initially rejected, she was sent where outbreaks raged uncontrolled. Her work helped prove what officials denied. Black nurses were not a liability. They were essential. These women received no bonuses, no pensions, no public honor. Some returned home weakened, some never returned at all. Families received little explanation. History moved on, but the impact remained. Their success forced change. The Red Cross quietly revised policies. Military medicine took note. When WW2 came, hundreds of black nurses were admitted, not because racism ended, but because failure could no longer be ignored. That door was opened by sacrifice. Aileen Cole, Clara Rollins, Frances Elliott, and others whose names were lost, but whose work was not. They fought a pandemic without protection, without recognition, without certainty they would survive. They didn't wait for permission. They answered the call, anyway.
When the Spanish flu finally loosened its grip, America rushed to forget. The war ended, cities reopened, life moved on. But the women who survived, returned, changed. Some carried permanent lung damage, others carried grief that never fully faded. There were no parades, no official thank yous, yet something had shifted beneath the surface. Institutions that once rejected black nurses had seen what happened without them. No public apology was made. Instead, policies quietly changed. The Red Cross revised its restrictions. Military medicine rewrote its assumptions. Not because racism disappeared, but because evidence became undeniable. Black nurses had gone where white nurses would not. They had reduced death rates. They had restored order from chaos. And bureaucracy, when cornered by results, learned to adapt. When World War II erupted, America faced another crisis, another shortage, another emergency. This time, they remembered. Hundreds of black nurses were recruited, still segregated, still limited, but present. They served in military hospitals, on foreign soil, under fire. Their admission wasn't generosity, it was precedent, set by the women of 1918. Modern nursing began to take shape. Standardized training, public health coordination, infection control protocols, much of it born from failure and from those who stepped in when systems collapsed. The lessons of 1918 became foundations: preparedness, community care, equity as survival. Yet their names faded again. Textbooks credited institutions, not individuals; policies, not people. Black women were folded back into the margins, their bravery assumed, their sacrifice normalized. But silence does not erase impact. In 2020, the world faced another pandemic, and once again, black healthcare workers stood on the front lines, overrepresented in exposure, underprotected. History echoed, but this time, some remembered. The courage wasn't new, it was inherited. Remembering these women is not symbolic, it's corrective, because public health without truth repeats harm, because erasure trains systems to ignore warning signs, and because acknowledging who saved lives changes who is trusted next time. They taught us that care is not neutral, that medicine is moral, that courage often comes from those society undervalues. They showed that professionalism doesn't require permission, and that showing up can rewrite outcomes. These women did not wait to be welcomed, they went anyway. They treated strangers, crossed boundaries, risked death, and in doing so, they changed American medicine forever. The 1918 pandemic did not just reveal who America valued, it revealed who saved America. 18 black women from Freedman's hospital walked into the worst moment of their time with nothing but skill and courage. Their legacy lives in every nurse who enters a crisis without asking who deserves care. Remember them, because the future of medicine depends on what and who we choose not to forget.